So welcome to the Ozone Summit. And because we have a short time to speak, I just want to go ahead and get right into it immediately. If for some reason you can't hear, just let me know or tell Jonathan what's going on. So let's go ahead and get started. One of the things that I wanted, let me see here. Let me see, I've just got to make sure that my slide will advance. 1 second. There you go. I'm just testing it. All right. Okay. So what I'm talking about today is going to be how ozone is being used today. What's the current use of ozone? And most of the information we have has been extrapolated from the human literature. And one of the things that a lot of my clients asked me about when I first wanted to use ozone in my clinic was, one of the biggest questions was, how does it work? Because they were concerned about toxicity. And that seems like there has been a certain amount of negative press regarding ozone because it's not very well understood and it's a fairly new therapy in medicine. And so I think the best use of our time would be to talk about, well, how can ozone be used in cancer? What's the scientific basis behind it? And of course, what are the mechanisms of ozone in cancer as we know so far? So let's go ahead and get started right away. So the current use of ozone right now is being used as an adjunct therapy to enhance chemo and radiation therapy. Now, it's not that ozone couldn't be used as a primary therapy. It's just that right now, we don't have a whole lot of studies, particularly in veterinary medicine for it. And even in human medicine, there's only been 4 cases of the use of ozone on solid tumors in the last 30 years. How we can look at ozone right now is that ozone is pretty much used as an adjunct versus a primary therapy, unless, of course, you're using it to treat something like a skin disorder, meaning a skin cancer. And then ozone can be applied directly and have a direct kill. Because the effects of ozone at this point, they produce indirect effects, okay? So ozone is producing indirect effects to treat cancer. So at a therapeutic dose, ozone is used to increase the oxygenation of cancer cells to prevent and decrease tumor growth. I think that's probably one of the biggest claims to fame of ozone at this point, is that many people recognize ozone as, there's O2 and then there's O3, one more oxygen, and that it increases the oxygenation of cancer cells, okay? Increases oxygenation of the body in general and cancer cells. What else does ozone do? Ozone modulates oxidative stress because it induces secondary messengers, right? It's inducing secondary messengers, and it's these messengers that activate a number of physiological processes which can help protect the body against the toxic effects that we see in chemo and radiation, while at the same time protecting the normal cells and body systems. Because most cancer cells have an exhausted antioxidant system, okay? And so a lot of times normal cells can withstand quite a bit more oxidative stress than can cancer cells. The other thing we're looking at is we want to promote a higher quality of life for our cancer patients post chemotherapy and radiation, not just during treatment, but afterwards, because a lot of us know that there are secondary residual effects from chemo and radiation therapy. So one of the things that we see here, the mechanisms of action that we're going to talk about briefly, you can see here is one is it's increased. It would be increased. Let me get my pointer out here. Okay, it would be increased oxygenation. That's probably one of the biggest ones we want to talk about, followed by immune modulation, as well as the induction of antioxidant detoxifying enzymes. We're going to be defining and going over a little bit more over these 2 pathways, and we'll do that as we go on, because the first is, both of these are transcription factors that coordinate. This one coordinates the expression of antioxidant detoxifying enzymes, and the NFK kappa beta pathway is another transcription factor that helps with immune modulation in the treatment of cancer. So what I would like to start with right here is I just want to go over, how does ozone increase tissue oxygenation? Okay, so what most of us know is that tumor ischemia, meaning poor circulation, and tumor hypoxia, we know that those are well-known factors in the development of cancer. Okay, why and why is that known? Because most of us all know that hypoxia in cancer cells favors tumor growth. And they also promote resistance to radio and chemotherapy, as well as a progression of and development of metastasis. Okay, so in 1931, Dr. Otto Warburg was awarded the Nobel Prize in Physiology for his work on the mode of action in respiratory enzymes in tumor cells. And he concluded that the cause of all malignant growth is actually oxygen deprivation, which leads to anaerobic respiration, anaerobic glycolysis in malignant cells. And so if we can treat tumor hypoxia, right, then we will have a chance to basically impede the growth of cancer, prevent its growth, prevent its metastasis. Because what most tumors do is they grow really rapidly, but they can't grow much beyond 1 to 2 millimeters unless they're vascularized, unless they have a blood supply. So neovascularization is very important. And so neovascularization, it doesn't just only promote the tumor growth, but also promotes the metastasis of tumor cells. And that's because the new tumor cells that are made by neovascularization are very tortuous, irregularly shaped, and they're quite leaky. And so many of the tumor cells can leak out of them and go to distant sites within the body. So hypoxia in tumors is characterized by this there's an increased distance between the cells to be perfused and the capillaries. And so it's been observed that the tumor growth, tumor vascular growth, is really chaotic and haphazard, and it results in a varying distance between the capillaries and the cells in some parts of the tumor. So the diffusion distance between cells and capillaries is critical. And if the oxygen can't reach cells, cells further than 100 to about 150 microns from the capillaries. And so this is the main reason that there's hypoxic areas within solid tumors. So they did a study looking at fibrosarcomas and mammary carcinomas, and they showed that poor tissue perfusion in the cancer cells, that the poor perfusion in the cancer cells were a major cause of the hypoxia. And so what they did is they measured the oxygen saturation going from the surface to the center of the tumor. And of course, they found that the intravascular oxyhemoglobin saturation was decreased going from the surface to the center. What hypoxia is also characterized by the induction of a thrombophilic state, meaning that there's several studies that have shown that cancer cells actually secrete procoagulant and tissue factor, right? And these bring about more of a hypercoagulable or a thrombophilic state, which also contributes to hypoxia. And so what we want to do is we want to do what? We're trying to treat the hypoxia within the cancer cells to help destroy the cells, but also to help perfuse the normal tissues as well, right, and protect them. The other reason for hypoxia in cancer cells would be that high rate of cell division, and because they're growing really rapidly and they're using up all the oxygen. So let's take a look at how ozone causes an increase in tumor oxygenation of the body. One of the first ones is that ozone increases the 2,3 DPG levels in the red blood cells. Okay, so it is something that there's been quite a bit of study on, and most of the studies that we have seen on them, some of them have been in actual measurement, and others has been in doing studies looking at how to reoxygenate PAC cells. So ozone increases the T2-3 DPG levels once red blood cells are exposed to ozone. There's an oxidation of intracellular glutathione, and then there's an increase in the rate of red blood cell glycolysis that leads to a stimulation of the 2,3 DPG, which produces an increase in the amount of oxygen released to the tissues. Okay, so specifically, There's an increase in 2,3-DPG, which promotes the hemoglobin transition from a high oxygen affinity to a low oxygen affinity state. And I always include in all of my presentations some of the references. If you want more information on them, just let me know, and I can go ahead and give those to you. So let's look at a study. They looked at the morphology of human red blood cells and the concentration of a variety of the different enzymes, including the concentration of ATP as well as the 2,3-DPG in red blood cells before and after treatment with ozonated saline with a variety of storage times. So the results showed that the effects of ozone in vitro on the packed red blood cells after 7 to 21 days contributed to the recovery of the morphology of the red blood cell and increased the concentration of the ATP and also the 2,3-DPG. Why is this important? Because what happens is that the longer the red blood cells are stored, the lower the concentration of the 2,3-DPG. So after 30 days, it didn't really have much of a pronounced positive effect on the parameters, however, after 30 days. Now they did another study where they looked at the blood parameters following early transfusion from acute blood loss using ozone. So they looked at the non-ozone group post-transfusion, and the red blood cells were characterized by a decrease in mobility, a decrease in ATP, 2,3-DPG, et cetera. And so most of those parameters were restored over 5 days, but the concentration of the 2,3-DPG remained decreased. This was throughout the whole experiment without the use of ozone. However, once they did a transfusion of ozonated blood, basically MAHT, it was evaluated, and then the post-administration showed that there was an increase in the 2,3-DPG concentration in the erythrocytes. And this value was maintained until the end of the experiment at a higher level than in animals that had undergone transfusion with the non-ozonated blood. So their conclusions were that if you ozonate red blood cells, it improves the functional metabolic state of them and promotes an earlier recovery of oxygen transport in the blood and limited the damage that they found in the heart. So another thing that ozone does is it can decrease peripheral vascular resistance, and that it increases blood flow. Why is this important? Because ischemia, as we know, or poor microcirculation, contributes to hypoxemia. And so ozone has been found to increase red blood cell membrane flexibility, and also, and when you increase red blood cell membrane flexibility, it helps to do what? It helps to decrease the shearing properties and to decrease blood viscosity. Blood viscosity, of course, will lead to problems with your microcirculation. It also showed an induction of nitric acid, which is produced by the vascular endothelial cells, to produce vasodilation to enhance the blood flow to the peripheral tissues. So if you decrease blood viscosity and you have vasodilation, ozone induces vasodilation, what will happen is it will decrease your peripheral vascular resistance, thereby increasing the blood flow. Now, they did several different studies looking at this. Particularly one was done looking at using hyperbaric oxygen. What the problem was is that the arterial PO2 definitely it went up, but what happened is that there was a reflex vasoconstriction that furthered tumor hypoxia following the treatment. So what they were looking at is, could we increase the oxygen using hyperbaric oxygen, then maybe combine it, then use ozone for its vasodilatory effects to combat that, to improve the oxygenation of tumors. Now, we do know that ozone increases blood flow. And what they did is they looked at a study. And this one was a really interesting study. And what they did is they were assessing the effect of ozone therapy on blood flow in the carotid arteries. Excuse me. And so, excuse me, when they did this, what they did was they put, they had 7 subjects, and they did MAHT on them with ozone-rich blood on alternate days for 1 week. And what they found was that carotid blood flow increased by 75% after 3 treatments, and that this effect was still present 29% 1 week later. And I thought this was really, really fascinating. They did another study where they found that the effects of ozone therapy was patient dependent, however. And what that meant is that the oxygenation had an inverse relationship with the baseline, and it suggests that ozone tends towards facilitating the capacity of autoregulation by a redistribution of blood flow from tissues that were not well vascularized or oxygenated to those tissues that were not. So I thought that was very interesting. Another study showed us that hypoxic cancer cells are 3 times more resistant to radiation therapy, and that even small increases in oxygenation can increase the effects of radiotherapy. And so this is very important. Ozone produces vasodilation, it improves oxygenation, therefore it's going to enhance the effects of radiation and chemotherapy. And if you improve blood flow, especially when you're talking about chemotherapy agents, you're going to increase the ability of the chemotherapy agents to reach the target. So we know that the relationship between free radicals and antioxidants is a very complex balance, right? It depends on their concentrations, the cell type, cell and tissue type of action. And so both sides of this balance can lead to like a beneficial or harmful effect. It just depends. The effects of ozone are very concentration dependent. You have to be careful. If you don't use enough, you're not going to get any effect. You use too much, it can be toxic. Most of us know this. And so because we've been able to develop very precise ozone generators, we now have a lot more leeway in terms of what is the concentrations that are going to give us the best beneficial results without overloading the oxidant system of the body. We know that increased oxidative stress is associated with cancer and toxicity, and a lot of the toxicity, we see toxicity and problems with redox system from cancer itself. But then we look at conventional cancer therapies, where a key therapeutic goal of chemo and radiation is to further increase reactive oxygen species within cancer cells to kill them. I mean, how many times have I heard, well, we can't really use anything else when we're having chemo or radiation because it might decrease the kill of radiation and chemotherapy, meaning they don't want to see vitamin C, they don't want to see anything else given because they're afraid that they're not going to get the kill rate that they want. Okay, and so you can see just from that how much ozone would be helpful in the treatment of cancer therapy, because it's going to help protect the normal cells, not at the expense of the kill of the chemo and radiation. It's going to help ameliorate those effects. So we know that oxidative stress is a condition where the reactive oxygen species exceeds the cellular antioxidant defense system, and there's an imbalance between the two. And maintaining the balance is really a challenge in cancer therapy. There's a lot of research going on and looking at the maintenance of reactive oxygen species and antioxidant production in cancer. How can we adjust those things to get the best results? So the goal of using repeated ozone treatments in cancer therapy is to create this resistance against oxidative stress to support the normal cellular and organ functions during chemo and radiation therapy. And I would also say that, let's just say, you know, the client in most cases is coming to you and the animal is having all the negative effects that you normally see with chemo and radiation. Okay, and we're going to be discussing this in just a few minutes. But what most clients want is they just want any kind of treatment that could support the animal through this process, because many of them are very dedicated to a conventional approach and they want to have help throughout this process. So once ozone, now we're going to talk a little bit about how ozone provides resistance against oxidative stress. And we know that repeated ozone treatments are necessary for this effect. So once ozone contacts all blood, body fluids, and tissues, it reacts with all the macromolecules in the cell membranes, and it creates reactive oxygen species and lipid ozonation products. And then what it does is these ozonation products, what they do is they induce the two transcription factors that I told you about. So there's the NF-kappa B pathway, and then the NRF2, and you'll see why they're important in a minute. Anyways, the NF-kappa beta modulates the immune system or the immune effect, and the NRF2 modulates the genes for detoxification and production of antioxidants. This is just for your own reference. This is just showing you that ozone combines with the components of the cellular membranes, in particular polyunsaturated fatty acids, and then it produces these two ozone. Okay, these are ozone messengers, right? So ozone has an indirect effect. It produces these messengers, and they are responsible indirectly for producing the effects that we see from ozone. And I'm sorry we have to go fast, but we do. So what happens is that ozone activates the nuclear factor kappa light chain enhancer of activated B cells. And it's a master transcription factor that's essential in normal physiology that plays a crucial role it's a critical role in gene regulation of inflammatory and immune responses. And by the way, targeting of the nuclear factor, kappa beta pathway is one of the hottest areas of cancer research right now. How can you adjust it? How can you turn it off and on? How can you modulate the immune system by using it to do several different things? One is to provide immune support, right, for the body, and at the same time try to attack the tumor defenses through this pathway. Okay, so this pathway is responsible for immune regulation and inflammation, and in particular, the production of cytokines. And we're going to talk about this in just a minute. Now, the immune modulation by ozone is nonspecific. In many cases, it really just depends. What happens depends on what cells we're looking at, meaning if it's lymphocytes and which type of lymphocytes, that type of thing. It's the pathways for ozone affecting the immune system are still being, they're still being elucidated. But there's one in particular, tumor necrosis factor, that we'll look at here in just a minute. But
we just got a minute or two left here too.
Yeah. So when we look at this pathway, it's activated by tumor cells, right? And it encodes, right, the transcription factors themselves, but the tumor can hijack this pathway. And when it hijacks that pathway, it then, of course, can start producing and changing the physiology to make it much easier for the cancer cells to continue to multiply. So this cytokine that's induced by the NF-kappa beta pathway, tumor necrosis factor, what we've seen is that preconditioning with ozone has been able to exert an inhibitory effect on tumor necrosis factor alpha production due to the induction of antioxidants produced through this pathway. Activation of the nuclear factor 2 related factor 2 pathway. It's a transcription factor that does what? It coordinates expression of genes, which encodes antioxidant and detoxifying enzymes. And so it can produce antioxidants that we're all familiar with. And this, of course, helps support the body systems, right, during chemotherapy and radiation, which further is increasing reactive oxygen species within the cancer cells. So these are the basic mechanisms by which cancer can be treated using ozone. And this is really just the nitty-gritty of it all. And I'm sorry we had to go so fast, but if you want to contact me via Gmail, we can give you more information then. Okay? All right.
Awesome. Thank you
You're
so
welcome.
much. Hang in here with me because we do have some questions.
Mhm.
And if you can stop your screen share now, that would probably be helpful. And we can just answer some of these questions, hopefully. Let's start at the top. Let's see. I can actually stop your screen share for you. There you go. Okay, so the first question is there any downside that you're aware of using rectal ozone with hemangiosarcomas?
No, at my practice, I've used the two forms of ozone that I use to treat cancer most frequently was rectal and MAHT. And I've treated any number of tumors within the gastrointestinal tract itself and the solid organs, and I've not seen a problem. Again, those people who know me know that I use Chinese herbs, ozone, and I'll use IV vitamin C all at the same time, but I've had remarkable effects. Yeah.
Great.
Right.
A question here from Dr. Kenny. He doesn't like it when I call him Dr. Fisher, so just Kenny. Are conventional oncologists on board with the use of O3 in cancer cases, or do they poo-poo it as with other unconventional therapies in your?
Oh no, they're afraid of it because the answer is always the same. I don't want anything interfering with the production of reactant oxygen species, and antioxidants are known to do that. And if ozone does that, I don't want you to use it. That's it.
Okay.
Yep. That's it.
Okay, next question from Dr. Roach. Does it help to inject tumors directly with ozone? Is that something you've done in your experience?
Yes. Actually, I looked at a study where they took ozonated water, I actually used saline, and used it to inject directly into a melanoma. Yeah. And for me, it shrank the tumor and worked pretty well because it was in an area that it couldn't really be removed, without some sort of amputation. But for me, I've used it, yes.
And I know this is a question that we've had many, many times before, this exact question. And the kind of the question that goes along with it is, is it more helpful to inject directly into a tumor or beside a tumor? And is it better to use ozone gas versus like minor autohemotherapy? Do you have any opinion on all of that?
Well, I can tell you that most of the time when I have used ozone, I did obviously look at the literature because you extrapolate so much from the human literature, and that's where I got the idea to do it, looking at the research in mice. So I should probably say that I typically had a tendency to inject the tumor with ozonated blood, and I didn't inject directly into it. I went around it. I went around, but I was able to inject it directly. I was able to inject it, what we call a surround the dragon type of injection, because the owners were desperate. So I told them what the risks were. I told them what the possible advantages and disadvantages were, and that's what they wanted. And what I saw tumors shrink. Some did, some didn't. Some responded very well, some didn't.
Yeah.
It depends.
Okay.
But I don't think the gas, in terms of using bagging on a tumor, say for instance on the paw, using a sarcoma as an example, I don't think that works as well as injecting. No.
Well, what about injecting ozone gas directly?
I typically don't do that with tumors. Actually, what I've done that more with is using it for pain, using it, in cases of like prolotherapy, prolozone, that type of thing. But I don't usually use the gas. I usually use ozonated saline or ozonated blood.
What do you find is the most, so this is again a question from Dr. Roach. How often do you treat your cancer patients? How frequently would you administer ozone therapy?
Well, typically, I think the two best things for cancer that I've used that's not local is the rectal and the MAHT. And they just had another paper come out this year that said that those two methods of administration were almost, the same, meaning in terms of the results. So as far as I'm concerned, rectal ozone is probably one of the best ways to treat animals, especially if you can't get a vein. And why is that? coming up because you asked me how often. Well, a lot of animals don't want MAHT and their veins won't hold up to it. They're resistant. So I did a lot of rectal ozone, and I usually did it every other day for 2 weeks, right? Then I did it at least twice a week for another couple of weeks. And then I would do it every week to 2 weeks just to see, it depended on the client. If I would do it as often as the client would allow me to do it, because that's how I got the best results. I had an animal that had a rectal tumor that they gave 6 weeks to live. It lived 8 months only on rectal ozone, nothing else, because she couldn't get it to take herbs. She didn't want to do MAHT. So I used rectal insufflation, and I would say it was remarkable.
Great. So here's a question from Amy Daly. She says, you mentioned using ozone as a primary treatment for cutaneous neoplasia. Have you used it for equine sarcoids? What is the route of administration for most skin tumors? Cupping?
Oh, no,
Injecting?
no. I used ozonated olive oil and injection. Yeah, I used ozonated olive oil and rectal insufflation. That's what I did for a lot of them, because the systemic route and then the local route. But in terms of applying it directly or injecting ozonated blood, to me, that worked the best. But I've not treated a lot of horses. No.
Okay.
I've not treated that particular condition.
Okay. Man, there's a lot of questions. Okay. they keep coming
Okay.
in. Okay. Use of ozone in immune modulation is or is not specific according to the analyzed cells, red blood cells. Does that make sense? That
Okay.
question to you?
First of all, the immune response to ozone is non-specific, meaning that, it can promote in general, enhancement of immunity, but it depends on the cell line, for instance, picking lymphocytes, it depends on the type of lymphocyte, right? Whether or not you're picking one that can increase CD4 or whatever. But when we're talking about the red blood cells, ozone in general will increase the 2,3-DPG of all the red blood cells. It comes into contact with it, and then it oxidizes the glutathione, and then it stimulates the increase of 2,3-DPG, which then increases oxygenation. And that's kind of in general. That's a claim to fame of ozone.
Okay.
Increased oxygen saturation, increased oxygen to the tissues, as well as a decrease, a decrease in the thrombolytic or the thrombophilic properties that you see in cancer. They're always wanting to clot. Yeah.
So Dr. Girardi asks, what dose of ozone saline ml and O3 concentration do you use to inject into a tumor? So what's that dosing look like for you?
Well, typically, you know how you have your chart? A lot of times I went by your chart, and then also I can't remember exactly because I don't have it in front of me, but I looked at what they did with the mice. So I was looking at what was the concentration that was used, but basically it's the same concentration that you use for saline. I mean, it's not really any different.
Yeah,
right?
and you were doing it with blood, not saline primarily. Is that correct?
Exactly. I was doing it with blood.
Yeah.
Yeah.
So
yeah. So I mean, it's like minor autohemotherapy.
Yeah. Yep. Exactly. So it's more minor
Yeah.
that we're talking about there.
Right. And for rectal insufflation, it was always 30 to 35.
Yeah.
Right.
Okay.
Micrograms per mil. Yeah.
So have you seen that you can reduce chemotherapy's dose or does that remain the same when you're using ozone? Any thoughts there?
What I saw was that the animals between ozone and Chinese herbs and decent nutrition, they couldn't tell they had chemo compared to the ones who didn't have it. They had a higher energy level because this is the other thing, ozone increases ATP levels, okay, in the body. It activates the Krebs cycle. So that cancer fatigue and lethargy, you can get rid of that by using ozone. I used ozone in older animals that didn't even have cancer to increase their antioxidant levels, increase their oxygenation, to make them feel good. 16-year-old dog, rectal insufflation, it's fantastic. In cancer patients, of course, it has that same effect. It increases ATP, it's going to increase oxygenation, increases microcirculation. Those things right there are going to make that cancer patient feel a lot better, but it made them so that they weren't so sick. They weren't having the vomiting and the nausea, because ozone has such a great effect rectally on the cells of the gastrointestinal tract. So right there, that's going to help a lot with the diarrhea that we saw, and also a lot of the vomiting. So vomiting, diarrhea, and the lethargy. And in terms of the red blood cell and white blood cell counts, how they drop during cancer, they didn't seem to have as high a drop. No one could explain it. And I looked in the literature for it, but I could not explain, other than the effects of ozone and herbs, of course, that I used, why it is that their red and white values did not go so low, but they were able to continue their chemo and radiation therapy, whereas other animals that had only chemo alone had to stop. They had to stop. And the other thing was wound healing. They didn't heal as well as the ones who had the ozone.